안녕하십니까.
Hello,
이재훈
I am
치과의
Dr. Sun Young Wee
선생님입니다.
from eGood Dental
오늘
Clinic.
서저리에서 여러분들과 함께
Today's case is about number 45 and number
45번,
46.
6번 임플란트를 식립을 하고
Prostheses had been placed there
노동을
after
계속
implant
쓰고
placement,
있었던 환자인데요.
but with gradual development of periimplantitis, as you can see on the X-ray, there was bone loss as much as more than half of implant length. What's problematic for this patient is that the abutment cuff height was very minimal at about 1 millimeter, so crestal bone loss was somewhat expected. And if you look at the extent of bone loss, cortical plates, both on buccal side and lingual side, have all evenly disappeared. Restorative treatment is actually impossible for this type of patient, leaving us with only the time-consuming option of removing the problematic implant and replacing it with another one and restoring hard tissues through bone grafting and GBR. So for this patient, I plan to use OneGuide to remove and replace the implant. As you can see here on the CT image, plate on the buccal side on number 45 has become very thin, accompanied with lingual bone loss. Although the number 46 implant position itself looks fine, there seems to have been a mistake in the vertical positioning, causing this problem. That is why I decided to use OneGuide, removing implants from number 45 and number 46, and placing shorter implants a little deeper. I used TS3 with the diameter of 4.5 and the length of 7 millimeters and performed GBR. Same implant for number 46 as well. And for number 47, which is also missing, I plan to place another implant, TS3, with the diameter of 5 millimeters and the length of 7 millimeters out of concern about future issues. And for number 45 and number 46 sites where the old implants were removed, GBR was planned with the use of OssBuilder after placement of new implants. Now, with this plan in mind, let's check the surgery video and see how it went.
임플란트 들어가겠습니다. 움직이지 않을 것 같아요. 한 번만 해주시고요. 자, 괜찮으세요?
How did you find the surgery video? You may find it quite complicated. When a problem occurs on hard tissues around an implant and results in biology complications, we are actually left with no better options but to remove the implant and replace it with a new one. That is the most predictable solution, but given that it is time-consuming and also causes patient discomfort, it might not be the best option. But I thought that is the only solution available for this situation. Here is the pre-op images. Fortunately, it was a screw-retained prosthesis, thus it wasn't that hard to remove it. First, the crown was removed, and you can see that there was serious inflammation around the implant. 2 implants were removed by using the EIR kit. And as you can see in the post-removal status, this implant's coronal part was not in contact with the bone, but instead biofilms were deposited quite thick. After removing the implant, a flap was opened, and this is the status after completely getting rid of the granulation tissues around it. By using OneGuide, 3 implants were placed. As checked in the video, I used 3-wall OssBuilder for number 45 and OB3 for number 46. So I used a protocol reconstructing the loss of buccal bone plate and lingual plate at the same time. And for number 46, I used a cover cap to submerge the implant. For number 45 and number 47, healing abutments were applied with one-stage surgery. This is a post-op panoramic X-ray. On the CT image, you can see that implants are placed for number 45, number 46, and number 47. One of the issues that can arise from using OssBuilder is exposure after surgery. For me, 8 weeks are a standard, so I aim to prevent it from being exposed for 8 weeks. My usual protocol is to remove OssBuilder in the 16th week. Removing at that time seems safest to me, but if there is partial exposure after 8 weeks, I can consider removing it a little earlier. And when it comes to delivery of prostheses, it is possible to place the prosthesis for number 47 in just 8 weeks. But given the condition of the adjacent implant, I made a plan to deliver the prosthesis in the 5th month after surgery. That was the explanation for a case where implants were removed from the mandibular posterior region after getting loosened due to peri-implantitis, and the sites were reconstructed. I wouldn't call this kind of approach the easiest, but to me, it is the most straightforward way. Thank you for watching. I will be back with a better case next time. Thank you.